Welcome, everyone, to the Positive Veterinary Dentistry Podcast, the podcast for veterinary professionals to elevate patient care through better dentistry, diagnostics, and better decision-making. I'm your host, Benita Altier, licensed veterinary technician specialist in dentistry, and the founder of Positive Dental Education. Today's episode is a really special one. We're going to step back in time and talk about the history of veterinary dentistry and one of the pioneers who helped shape the profession as we practice today. Many veterinary professionals know the textbook Veterinary Dentistry Principles and Practices, first published in 1997. At the time, it became one of the most comprehensive resources available in veterinary dentistry and was often referred to as the Bible of veterinary dentistry. A driving force behind that book was Dr. Robert Bruce Wiggs, a veterinary dentist whose dedication, knowledge, and vision helped move the field forward during a time when veterinary dentistry was first developing as a specialty. So joining me today is Dr. Heidi Lobprise, who co-authored that landmark textbook with Dr. Wiggs and later helped lead the development of a second edition now titled Wiggs Veterinary Dentistry Principles and Practices. So Heidi, thank you so much for being here and for helping us to tell the story of Dr. Robert Wiggs and the evolution of veterinary dentistry.
Thanks for having me.
Absolutely. This is our second episode we're recording together, and I knew you'd be perfect for this because the amount of dedication, time, and effort you put into this profession and how you all were one of the pioneers in making sure that veterinary dentistry had a future for our profession. I would love to learn just a little bit more about how that began for you and how you met Dr. Wiggs and what we could learn from the early beginnings.
My story is I had small animal veterinarian, and I was practicing in the Dallas area. I'd graduated from Texas A&M in 1983. And it was in 87 where, someone approached me to do a startup clinic with him and everything else. So I left that practice I really loved. Plus a friend of mine who was just graduating was going to take my place. And then all of a sudden, that other practice offer just fell through. So I started doing relief work. And in doing that relief work, one of the clinics that I worked at on a regular basis, in fact, almost every Friday, was the Coit Road Animal Hospital, CRAH. And Dr. Robert Wiggs was there. And at that point in time, he was doing a lot of dentistry. He had actually done some dentistry with Don Ross when he was at A&M, because we all know, especially back then, but even today, you don't get much dental education at the university system. Some areas are better than others. And I started working, but just small animal practice to help him out with that kind of thing. And going along, 87, he was doing some things I kind of learned from him. 88, I believe, is when they formed the American Veterinary Dental College. He was part of the academy, and he wasn't in the original 8 people, but he was in the first class that credentialed, qualified, and sat for the exam. Of course, he passed. I mean, I think he probably had that original 8 looking over his shoulder, kind of going, okay, that's how you do it. See, he also had an interest in dentistry on the human side because he was part of, it was back then Baylor, now it's a Texas A&M system school, the dental college. So he was on staff at the dental college. He did all the IACUC information about that. Then he also helped with labs that the dental students would do on sometimes with dogs and lab animals, things like that. So at least on Wednesdays, he went down there every day. And during that as well, he collaborated with the dental educators there. There were some amazing ones that we got to know through the practice as well. So he really continued to build that dentistry acumen doing that in addition. His interest in it was beyond anything I've ever seen. The gentleman was shy on everything else, very, very, very quiet. But if you asked him a question about dentistry, make sure you had plenty of time for the discussion, because he could tell you the history behind it, the mechanics behind it, the everything, all the details. I mean, he just really grasped this well. The thing of it is, getting into his practice, so many things in my life, I've always mentioned being God things. I hadn't planned on doing relief work, I was going to go open up this new practice. So really everything worked the way it was. You could not have told me at Texas A&M that I was going to be doing dentistry as a specialty. We didn't get much there. I think we got more equine dentistry. And then after I started working for him, and then he was getting all his paperwork together for the college, he wasn't the best organizer. So I was extremely helpful with that. And I was, helping him with the logs and cases and everything else. And then later on with writing and even putting together talks. And he became a diplomate. And at that point in time, let's see, I got married in 88, had my daughter in 89, and he became boarded, and he kind of went, well, what would you like to do, a residency? And it's like, again, just people who sought after him in later years. And there I was. Like I said, it was a God thing. It definitely was. So yeah, I did my residency with him. I became a diplomate in 93. Now in the interim too, so I wouldn't suggest anybody do this, but it worked out for me. I had my daughter Holly, she's now 37. He even changed the break room so we could put the crib there. Aww. I brought her with me to work till she was 6 months old. Wow. Then she started chewing on things, so we found a place for her. But yeah, it was a small group, but a huge family. It was absolutely amazing. And to say learning things, trying to take a sip out of a fire hydrant, he knew so much. He had so much interest, even in the historical aspects of human dentistry, the books he had. Absolutely amazing. And so I did my residency with him. We actually also, his notes that he put together for me, quarter by quarter, 8 quarters during the 2 years, plus a little extra time, became the teaching tools for the early residencies in the dental college.
Wow.
We basically, we put it together, and once I got in the college and was doing some of the training committees, things like this, we would just make copies of it and mail it out and whatnot. Yeah, back in the day when we didn't have many members of the college, you did a lot of committee work. Mm-hmm. You did multiple committee work, But he was also like head of the training committee to begin with. He did the exam committee a few years. And it was just an amazing time. A lot of things being learned. I look back now and we look at even right now, pathogenesis of periodontal disease. We have new information coming in all the time. But literally standing on the shoulders of giants. Yep.
So during this time, you were also working in practice. You just had a new baby. I can't imagine, how on earth you accomplished all the things that you accomplished. And I'm sure that with you having such an amazing mentor, he was probably there with you every step of the way. But I can't imagine how you did all that, Heidi.
I had a lot more energy back then.
Okay.
Yeah, I remember even bringing home, of course, when we were doing the writing, but even like back then, not much was computerized, the day sheets, working on the day sheets to help him out, that kind of thing. And being able to take Holly with me was a blessing, but it was also sometimes a little challenging. But, we'd be sitting there and she'd be up and around, and I'd have to take a client's dog to the back to do something. I was doing both general practice back then too, and learning the dentistry. And I'd kind of go, okay, well, let me just go put her in her crib. And the people go, oh, I'll hold her for you. I mean, that's what this practice was like, back in the day. Right. Back in the day.
Yeah.
And of course, all the ladies who worked there too, they were her aunts. So it was challenging at times. I look back and wonder how sometimes we made it through, but we did. And from there, we even ended up having, other residents, Dr. Paul Mitchell, Michael Peak, just some amazing people.
Right. Yeah. I know Dr. Mitchell and I have talked about this a little bit before, how incredibly blessed he was to have that mentorship that shaped his career as well. Back in that time, when you guys were doing the dentistry on these patients, was it common to do dental x-rays in the early 1990s, late
Well,
80s?
with Dr. Wiggs, it was. We did
Okay.
x-rays on everybody. We
Okay.
actually had an old wall-mounted dental unit from a dental friend that he had. And we were doing the films and chairside developing.
Mm-hmm.
So,
Yep.
in fact, I do recall later, he didn't go into digital x-rays too quickly because, not theoretically, in fact, hard films, they do the image basically molecule by molecule, what changes on the x-ray film. On a digital x-ray, it's pixels.
Mm-hmm.
So you can actually get better detail on a hard film. You just have to store them properly, etc. Of course, it took a little bit of time doing all the dipping, and that was kind of fun. We even did a kind of, I wouldn't say tongue-in-cheek, but kind of fun thing, making your own dental chairside developer out of a bucket.
Out of a bucket?
Yeah, out of a bucket, having a light shield on top and being able to put your hands in and do it, and just different containers like that if you couldn't afford the chairside developer or whatnot.
Yeah.
But yeah.
That's awesome. We started at my practice with dental x-ray in 2001. So a good 12 years after you did, right? Probably. But it was with film and the chairside developer. So I can appreciate how that goes, and
Yeah.
definitely the time it takes to get
Oh,
those
yeah.
images and developed. And then if you have to do any retakes, that increases the time. So it takes a lot of dedication, but we understand the importance of dental x-ray, and you guys did then as well, because you really can't see what you can't see without those dental x-rays and
Oh, absolutely.
information.
So
Were you commonly doing root canals at that practice at that time, or more advanced dentistry?
did quite a bit. In fact, root canals, crowns. At the time, he would even wax his own models. So the waxing technique, he would build the wax of what he wanted the crown to be, then take it down to Baylor and have the metal crown made. So we were making the stone models. He was getting the area specific and putting the spacer material on it, then literally using the wax and making the crown himself, the crown base, so to speak. And then it would go in and get made into metal. So he was doing part of that. And he actually ended up doing some jewelry because of that too. We did everything from, at Christmas time, we would take models. He also did a lot of exotic work, Dallas Zoo and Fort Worth Zoo, and a couple places out in East Texas. We had a model of I believe it was a chimp, and we made stone models out of the impressions and gave those away as gifts. We would make stone models out of a dog's mandible to make card holders for people. And then we were even doing chocolates one year. It was all about teeth. All
And
about teeth.
I remember you said that you would like to do crafts for a living when we had our last
Yes.
episode. That must have been kind of like part of that. It's like dentistry is kind of
Yes.
an art
Oh, so many
form.
choices. I'm actually getting some crafts together to take with me to Honduras.
Oh,
Yeah.
awesome.
Yeah, all the stuff at dentistry, the composites and everything
Mhm.
else, it's got a little bit of a feel for it, arts and crafts.
It is arts and crafts. And then we talk about prosthodontics. That was probably very unusual in veterinary dentistry, even for some of the original veterinary dentists to be doing crowns. Would you say that's true? Or do you think that most of them were actually doing the prosthodontics?
I would say that the major players at that time were comfortable with doing crowns.
Okay.
We knew there were some distinct differences from how humans had to do crowns. Now we've got some really good studies and whatnot that kind of back up all along what we were doing. In addition, back then, orthodontics were big. Now, that's, don't do too much anymore. But he quite often would make his own devices a lot of the times. He would make maxillary arch bars. And of course, we used regular human buttons, things like that. We did for some telescoping inclined planes for base narrow lingual version teeth. I did send those out. We worked closely with a couple of labs, but he did a lot along those lines.
Wow, that's awesome.
And
Yeah, I really like orthodontics. I actually would consider being a human orthodontist if I was wanting to do something in human medicine. I just find it really fascinating how we can use those types of forces to move teeth into a better position. And it's kind of sad for me that we don't do that much orthodontics in veterinary dentistry these days. Mostly people are doing crown shortening procedures to alleviate painful malocclusions versus moving teeth around a little bit.
well, it's quite often the inquiry from a breeder,
Mm-hmm.
and we're very specific about why not. But
Mm-hmm.
also with human orthodontics, yeah, you have some issues. You lose the pop off. With puppies and orthodontics, that was a challenge for the owners
Yeah. Yeah.
to keep everything on and to keep the elastics doing and adjusting the elastics. It was kind of a pain.
Yeah.
So
Yeah. It's
I
not
don't miss it
easy.
too much.
Okay. So was Dr. Wiggs still going to work with the school and the human dental students?
Still going on Wednesdays, most
Okay.
Wednesdays. Sometimes he would help with different classes, different labs. He also, like I said, was the IACUC chairman for that facility. So he had plenty of paperwork there
Mm-hmm.
and relationships with the group there. And then when he had time, if there was different conferences, he'd be able to go there as well.
Okay.
He stayed quite active.
Yeah. Now, did he have a family? I mean, it sounds like his whole life
Yeah.
was so dedicated to what he was doing as a veterinarian and a veterinary dentist.
So while I was there, he an elderly mother and father.
Okay.
And even though there were siblings, he was, of course, the responsible one who took care of everything, which kind of made sense.
Yeah.
And yeah, his health wasn't that great.
Okay.
He was the primary caregiver for his family, and sometimes that was quite a burden on him.
Mm-hmm.
He never got married. His life was dentistry.
Yeah.
His life was dentistry.
Well, I didn't get to meet him, which I'm very sad about because I wish I would have been able to get to know him. I've heard so much about him from people like yourself and others. And it sounds like, if I could imagine it, that when you started talking dentistry, I could just see the light in his eyes kind of just brighten up, like what you said, like that was his
Yep.
true passion in life, is really having an impact on the profession in this way and being able to help animals the way he knew how. And I could imagine that would be pretty magical to be able to be mentored and to work with someone like that. So,
He also had a bit
great
of a
thing.
dry sense of humor too, though.
Oh,
It
yeah.
was
Okay.
often quite subtle, so you had to be aware of it.
Okay.
And I don't know if Dr. Ed Eisner spoke about it, but they were the Stooges.
Okay.
Yeah. He and Steve Holmstrom and Ed Eisner, and I think later on Greg DuPont, they were the Stooges. In fact, I think they dressed up. We often had Halloween costume parties
Okay.
around the forum because it was usually around Halloween.
Yeah. Yeah.
And they would always do something because they were kind of presidents after each other too. So there
Sure.
would always be something happening when it was
Mhm.
time to turn over the presidency. There'd be, cowboy hats or crowns or things like that. So it was really neat to see that dynamic with that group as well. The old guard, the
Yeah.
old gangsters.
The gangsters, original
But
gangsters.
yeah, he had an interesting sense of humor. And even though, with his mom and dad, and then he had brother and some other, when it came to things like Christmas or different things, the clinic, oh my gosh, that was his second family.
Yeah.
He had so much fun getting presents for everybody. Of course, he would be wrapping them at the very last minute, and I'd probably in there helping him. But he really enjoyed that. He was very quiet, but so kind.
Well, it sounds like he probably also had a place in your family too, like with your
Oh, yeah.
daughter and everybody being so close, that it sounds like it would have been a very special relationship.
Yeah. And his door was always open to anybody who wanted to visit.
Mm-hmm.
We had people from all over the world coming and visiting.
Okay.
Yeah.
That's awesome. Do you have any idea over the years how many residents he actually mentored?
It probably not as much as like in the university system,
Mm-hmm.
because we only did on the residency side one at a time. So myself, And there are a couple who didn't quite make it through all the way.
Sure.
But he also did some, back then we had the alternate pathways.
Mm-hmm.
So there are several people who got through that, and he helped me with mine as well, like Dr. Burt Dodd and Dr. Andy Duke, who was fellow. He was also very active in the Academy of Veterinary Dentistry, the fellows group. He was very active in that as well. So, and like I say, we had people now, Japan, Australia. David Clarkin came and stayed for us for a while. He even then would go to the homecoming parade where my daughter was in the dance troops and things like that.
Wow.
And Barrett Hall and Alex Ryder came and stayed for a few weeks, that kind of thing. So he's always open to having
That's
people
amazing.
come and stay and learn.
Very welcoming. He had so much to offer and so much to give. And I know all these people that you just mentioned, they probably were so glad to be able to come and learn from him. And it sounds like from what you said that he was really just gifted when it came to actually doing the hands-on type of work and
teaching.
Yeah, and being able to mentor and teach other people. Were there any specific techniques or anything specific to his way of doing things that you adopted that you felt were kind of game-changing for you?
So I think one thing, and I keep meaning to write this up too, because I don't see many people talking about or doing like using a post with developing a crown, using an inset post and the burnout post. They use specific burnout posts in people dentistry.
Okay.
We would take the bristles off a hairbrush and use that as the plastic burnout post. Then he would build the wax build up around it, and it'd be one piece post and crown. And I don't see that too much, but it really helps it with the retention.
Okay.
He was really big on teaching people to sharpen.
Oh, good. That's one of my passions.
Oh yeah. Major. Probably the endodontics he was very good at.
Okay.
And oral surgery. Yeah, just a lot of little things.
Mm-hmm.
Yeah.
Well, and it's sometimes those little tips and tricks, right? And you learn that from one person, and they may have invented what they're showing you, right? Just out of like necessity and just ingenuity and having the problem that they needed to solve, and they wanted to make whatever they were doing more successful or have an easier way of doing something versus what maybe someone else had thought of doing, right? Because these guys were pioneers and gals. You guys were figuring it out from the ground up and trying to take human dentistry and what they were doing there, but then you needed to emulate that on animals, and animals come in all different shapes and sizes and varieties and different sizes of teeth and different problems than humans. So it can't be exactly like human dentistry, right? So we have to modify what we're doing.
One huge thing, I can't believe I almost forgot, he would make his own instruments or adjust his own instruments.
Okay.
And so he was using these human dental elevators.
Okay.
And because of the shape of most of the roots, he actually invented the winged elevator.
Right. Well, we cannot forget this because
he sent that to Dental Air back in the day.
Yeah.
And so they started producing it. And originally, in fact, I have a little handbook that I need to give to someone before I kick off that was Dental Air Wiggs's winged elevators.
Okay.
That's the only time that I've ever heard his name associated with them. He never got, and he didn't do any kind of patent. He goes, no, it just, it'll be good for, okay. And now almost all of them are winged.
Yeah.
If he'd gotten a penny for every winged elevator, but he invented, and he was also a great illustrator.
Okay.
All of the illustrations in the first edition are Wiggs's originals. All right. And I actually had someone help me copy them. So we had availability for the next book. But yeah, he was a great illustrator as well.
Wow. Yeah, true artist. Because like you said, the dentistry is such an art thing and there's so many crafts and arts involved. But that's amazing that he was able to illustrate. I think that was such an important point that you mentioned about the winged elevators, because I knew that those were Wiggs winged elevators because I've been in the profession long enough at this point to remember the days when that's what people called them. But I didn't realize that he didn't have that patented or some sort of legal pathway to claiming fame for that, but we definitely want to give him all the accolades now because that was his invention and it really did change the game. I think everybody loved winged elevators and they still to this day, that's the preferred type of dental elevator out there. So at what point did this idea of creating a textbook come into play? Like, how did this start with Dr. Wiggs and yourself and others?
Yeah. So to begin with, for each quarter of my residency, I had to produce a paper.
Okay.
So that's kind of where some of these little smaller ones, the chair side, different things like that, or collaborate with a paper. Mm-hmm. And then he was also writing articles for the Journal of Veterinary Dentistry. Couple of my earlier ones were more like anatomy of the tongue or salivary, things like that. Okay. That's where I was on the baseline. But I was having to study that and help me study and research and do everything. And we started building enough of these basic ones, everything from classes or composites, doing crowns, or the crown finishes and everything like that. It was kind of like, well, I guess we kind of sort of should. It wasn't as deliberate. There was Wiley back then, may have been Blackwell, Wiley. And it always tickled me that he would do certainly the more formal, advanced kind of stuff and write it up. And I'm kind of a grammar type of person, syntax, where's the period supposed, that kind of stuff.
Right.
And so I would be reviewing this stuff and I would go to him and say, so you saying this, can we, make it easier to read, or so to speak.
Right.
And almost every time he'd go into that discussion of the theory behind it, and said, yes, I know that. I just want to talk about sentence structure. But he just knew all the details. So It was really a pretty good collaboration because I think it's still fairly readable. Yeah. Although I do claim that if you do have problems sleeping, it might be a good book to grab. I think there was one diplomate when he was studying, he goes, oh yeah, I go to bed with you every night. Okay.
Well,
and his wife approved, so that was okay.
This is back in the day too, when it wasn't really super common to have a computer to do all your writing on, right? So are we talking like typing on a typewriter, or are we talking about
early days he typed on a typewriter?
Okay.
We did have computers, not so much for the front, but for us to do some of these things.
Okay.
But thinking back then too, in doing presentations, it was all Kodachrome slides.
Right. It wasn't PowerPoint or
so I would be the one who'd take all the pictures from that week, take it to there was this one place who did slides for fairly reasonable. And it was pretty good drive. And then I'd pick them up and bring them back, and I'd help him label them because you had to get them in the right order. And then heaven forbid you would drop your cassette and they'd go everywhere. But his title slides, he would build the words on the computer screen and take a picture of the computer screen.
Wow.
To make that slide.
Wow.
Yeah.
We think we have it hard these days.
Now we've got AI helping us.
Yeah. And Grammarly and other programs to help you so you can get your sentence structure right. Oh my goodness. But that's when you truly learn things. I love how you said that you are already having to, as part of your residency requirements, write up specific things, because when you do the research to actually write some text and do something that's publishable, you learn so much from that process. And I'm sure that helped you tremendously, but then it was also the beginnings of this textbook. Was it hard to find a publisher? I could imagine you have all these things written, but did veterinary dentistry at the time have a following that they thought they could sell these books?
So I think he worked with people he knew from Baylor.
Okay.
And I think that's where his in was. Yeah. Because back then about the only thing was out there was the Tholen book. And then Harvey and Peter, Emily had one, and that was about it. And that was fairly simple and a lot more pictures with techniques and things like that. I know Steve Holmstrom's early ones were technique based, and this was principles.
Right.
This was a lot of the meat behind it, but also practices. Yeah. And I was thinking, doing some of those papers too, our research wasn't going to PubMed and getting this article. It was taking a book off the shelf and reading it There was no searches, although he did have access to articles and he would print out of articles. So yeah, it was a different learning process.
Dr. Wiggs sounds like he was very inquisitive. Were you doing any type of research projects with him? Anything specific that you guys were working on to also build knowledge base for a textbook like this, or even just for his own use?
I would say more in doing, like I said, the papers were more like initially anatomy based, and it was more case based. We did a couple short things, like there was a couple products looking at that, but not as much as on a university level.
Okay.
Although one thing he was also like the start of, so to speak, is he was president of the Dental Society when Hills developed TD.
Oh, yeah.
And that's when National Pet Dental Health Month started.
That was back in 1998.
So he was the first spokesman for that.
So.
Pardon?
That was back in 1998 or so, I believe.
Yeah.
TD became the first product that they launched that was on the VOHC. Now, was VOHC in existence?
Not quite yet.
Okay.
But because of some of the parameters they developed, in fact, Mary Berg was part of that too, looking at plaque index, calculus index, and even with them, they had their oral odor index.
Oh, wow.
But back then, it was people trained to sniff. They even, I remember, had a short documentary with Alan Alda from MASH.
Oh, gosh.
And talking about how they did this oral odor assessment before we had halometers and things like that. But yeah, so he was going on press conferences and everything else. And they had the new diet and they were funding that quite well that year.
So Dr. Wiggs was going on press conferences?
Yeah, okay. That was tough. He had to go to Sears and get a new suit.
Okay.
Or at least a new suit jacket.
Oh, wow.
He was a very simple person.
Well, and he found his voice, because you said he was very quiet and kind of shy. But here he is doing press conferences about Hill's TD food and the impact that will have. Wow. Those are really cool stories. So what year was the first edition published?
1997. Yep.
Okay.
Got that out. That was a lot of taking stuff home at night and working on it. And yeah.
Well, I bet it was a proud moment for you both.
Very.
What was the reception? Was there a lot of veterinarians that were actually really excited and buying this textbook?
So the community was a little bit smaller back then, but it was with one review that was so very well received. Of course, he focused on that one review that was like, what could I do better? What did you do? That kind of thing. But yeah, most pretty good acclaim. The depth of it, the breadth of it, everything that it covered was just beyond what anything else had done at that point.
I think veterinarians in general practices were really hungry for this information. Sometimes they didn't know they even needed this information, but then they kind of did know they needed this information because veterinary dentistry wasn't taught in school, but they were being confronted with cases that they didn't really know how to address. And where the beginnings of dental x-ray as it rolled out into veterinary medicine needed to be understood, I'm sure that this was really instrumental in helping people at that time learn more about all of it.
Exactly.
So after the textbook was released and time goes on, what was Dr. Wiggs doing at this point in time? Because I bet he probably wasn't stagnant. He was probably thinking about the next thing that he wanted to work on.
Yeah, I mean, he was always doing, of course, with his residencies and doing different papers and whatnot. He just stayed pretty busy. He started having some health issues later on, of course, and he passed rather young. We wish we could have had him a lot longer. But I mean, he was on the AVDC board. He was president. He was with the foundation board. He was on the Peter Emily Dentistry Foundation. He did a lot of work whenever he could with exotics. So he had a lot of irons in the fire.
Did he like to travel with the Peter Emily Foundation to go to exotic places, or was that not quite his thing?
Well, he enjoyed doing the work. I'm not sure that the travel was as much fun. I mean,
Okay.
I do know, I remember one story from him. He did go down to Australia to speak, and then David Clark was down there and visit some of his people down there. And I remember they put him in this row in between two mothers with babies, and they were spitting up on him. And of course, he says nothing. He just kind of sits there.
Right.
So,
You got to go to Australia and adventure with Dr.
absolutely.
David Clark, so that's pretty amazing.
Yeah.
And Dr. Clark, was he a veterinary dentist at that point or not yet?
And he had done a residency with us.
Okay.
And then also, there were some that aren't some dental types. Not all of them are diplomates, but
Right.
several people down there that he knew too.
Okay.
Yeah. So
Perfect.
they invited him to come speak at an association.
Did Dr. Wiggs ever discuss with you any specific exotic animal that he really enjoyed working on, or any specific case that he worked on that kind of stood out in your mind that he talked
Well,
about?
we got to do some of the zoo work. It was usually on Sunday, though, so I had to miss it because, church and Sunday school and stuff like that.
Mhm.
But I remember working on the gorillas with him
Okay.
and the tigers and lions during root canals. But one story that Mike Pekin he has from going out to, there's an exotic ranch, I think it's Black Beauty Ranch in East Texas,
Okay.
that there was a chimp there that had some tooth problems. Okay. I don't remember his name, but I do remember they talked about how he was signing. He was a signing chimp.
Oh, okay.
And so, he loved his coffee, and sometimes he had problems with the cold drinks. I think he got beer every once in a while. But when he started showing, saying that he had pain drinking his warm drinks, that's
Okay.
not good. With
No.
cold plates, something's wrong.
Yeah.
So they scheduled something to go out there and do the dental work on him. Is an older chimp, pretty good sized guy. And they had him in the closure, and then they darted him.
Mhm.
And as he was getting sleepy, I think Nim, his name was Nim, he was signing, "Nim loves you. Why you
Aw.
hurt Nim?"
Aw.
As he's getting sleepy.
Oh
And
my
sure enough, he
goodness.
did need a couple extractions and root canals. So I guess he could drink his coffee after that. But that was always a kind of fun story.
Chimpanzees just fascinate me. I can sit there and just watch their interactions with each other all day going to
Oh,
a
yeah.
zoo. I've never seen them in the wild. So just how intelligent they are, and just knowing that they can use sign language to actually communicate with humans in a way that we can really imagine and understand that they do understand what they're trying to say to us. And we weren't trying to hurt him. I'm sure we were just trying to help him. He just didn't
Yeah.
understand, right? It's like having a small child. You can't exactly explain to
Mommy.
them why this has to happen in order to make them feel better. What do you think, if Dr. Wiggs was alive today, he would think about the future of veterinary dentistry? I mean, do you imagine that he had a vision for the future of veterinary dentistry, or where we could take that he would love to tell us about if he was here today to explain?
Yeah. I think part of it is he would be so supportive of getting more education at the universities. I mean,
Okay.
we at least finally, the COE, Council on Education, stated that, I think it was 2020, that dentistry is a core
Yeah.
thing. Yeah.
Right.
So I think the education going on, I know he was really excited about doing some of the advanced work, things like that. Even though he's a little slow to adopt the digital dental radiography, I can see him getting cone beam CT and doing studies and looking at different things like that. But continuing with the teaching, absolutely.
Yeah, he doesn't want to see all of what he built crumble down,
Yeah.
and he wants to see advancing the profession through education at the basic university level with our veterinary students, and I'm sure veterinary technicians. Was he very involved in regards to having veterinary technicians get education on the dentistry
Back
skills?
then, it wasn't that advanced.
Yeah.
And he had legacy people there at the practice who highly, highly competent, even without those letters. And I prefer
Absolutely.
the letters myself. Vanessa Huizar is my dental technician.
Yeah.
But he always recognized what an important impact the technician group just was cheerleader all along.
Excellent. we're a team, and I'm sure he recognized how important that was. But he also probably gave them a much better education in dentistry specifically than what they would get if they went to a technician program, sadly, because still to this day,
quite
it's
likely
lacking in veterinary technology programs,
Yeah.
spending the time that we really need to get people competent, proficient, and educated. So you and I will never run out of people to teach, unfortunately or fortunately, because there's such a need out there due to the lack of education in the schools at that level in order for us to function the way we normally function, to just
Right.
even match where we are with dentistry today in a
Yeah.
general practice
Job security.
setting. Yeah, no, absolutely. You and I, we definitely have a lot of job security in that for sure. But Dr. Wiggs and his vision for the future, and it's exciting that we have technology like cone beam CT, we have digital dental radiography. I know veterinary dentists are 3D printing models before they go to do oral surgery cases, and all of the research that's going on to help us better understand certain conditions and stem cells and different things that we can use to try to help to improve the conditions that these patients find themselves in. Things have changed a lot, and it's hard to even envision what that future might look like. But I would say Dr. Wiggs and yourself have been truly visionaries in being able to think bigger and imagine better and be able to manifest that and be able to create that, because without people like yourself and Dr. Wiggs being able to have that imagined vision of what it could be like, it wouldn't have gotten to the place it is today. That's for sure.
It sure has progressed.
It has. And I started out in 1987 and 88. And back then we weren't doing great pain management. Speaking of pain management, was it very early on that you guys adopted doing like nerve blocks? Since I assume that would have been part of human dentistry, and Dr. Wiggs would have imagined that being important for animals as well. But at what point did that become a part of what you guys routinely did for dentistry cases?
We did it from the beginning.
Nice.
Like I said, with his information with human dentistry. Yes.
That's great.
Absolutely.
Because back in the late 80s, that was very, very uncommon. We did not start doing nerve blocks in my practice until 2005. So,
we used to have the Hycodan, like the Tylenol 3, to dispense because we didn't even have carprofen.
Right.
So
the advent of some of these drugs that were safer for animals. We can't just use drugs that we use in humans because they aren't safe in dogs or cats. But yeah, you were so limited on what your options even were. But thinking, gosh, we got to do something about the pain. What a amazing thing to do, and make sure that we aren't leaving these animals uncomfortable with the surgery on top of painful things. So that's great. Are there any other specific things that he invented besides the winged elevators, but any other thing that we should give him credit for that you know about?
Well, I know back in the day, he started using a triple calcium phosphate type implant material for extraction sites before we had any of the BioGlass console. That was the earlier ones. And then the bone type material. So possibly that.
Okay.
He would get his own specific instruments that he'd like and kind of work with them a little bit. I don't know. It's so long ago.
Yeah. It's hard to remember all the things, because I'm sure there was a lot of things that he just did that you just took on and did.
And I kind of didn't realize they weren't being done.
Mm-hmm. Right.
You know?
Yeah, because it wasn't as common. I mean, you had that core group of people that probably did talk to each other quite a bit, but there was a lot of things being done at the time, different practices across the nation and other countries even, that nobody was talking about together. Right? And nobody was publishing.
That's right.
Mm-hmm. So you'll definitely have to publish or write up that post that you talked about.
Post-crown. I know. I need to do that. I even have some images.
Oh, great.
That I got back a couple years ago with one of my residents saying, oh yeah, I really need to do this. And then I started doing a bunch of buried knot suturing, and one of my residents said, you really need to write that. Okay, I'll get it. Well, someone else got that one written, so we're good there. I don't have to do that anymore.
Well, no, absolutely. You should definitely make yourself a little list of things that you want to get published because, yeah, it's
Well, the
definitely a
third edition of
contribution.
Principles and Practices is going to be in the works soon, so
Oh, really?
that'll
Okay.
keep me busy.
New contributors for that as well, or
Some new contributors, some shuffling around a little bit.
okay.
On several of the chapters that I ended up doing, I definitely have some people taking over those.
Get some new perspectives and add to the
Absolutely.
information. We have new information coming out on all the time. And yeah,
Yes.
but I love that you guys decided to title it Wiggs because what an honor to bring it back to the original author of that book and editor, chief editor. Well, maybe you were the chief editor.
And we actually, except for some of the, because of, some of the inheritance type things, but our portions, we actually donated to the Foundation for Veterinary
Perfect.
Dentistry for that
Nice.
well, it's the second volume. This one will be the third volume. And we'll take it from there.
Right. Is the first edition still in print or it's not,
No.
right? Yeah.
Nope.
Yeah.
I've got 2 copies.
2 copies.
Uh-huh.
And I assume they are signed by Dr. Wiggs, hopefully.
You know what? I don't think they are.
Oh, no.
Yeah,
I know.
I don't think they are.
Well, I kick myself every day because I was really, really good friends with Patricia Frost Fitch.
Oh,
and
yes.
I wanted to take my copy of her book and have her sign it. And I saw her 2 weeks before she passed away, and I didn't take the book. And I just kind of felt a little bit anxious about asking her to sign it, but I so wish I would have had her sign it. She was such an inspiration to me. And that book was also one of the early texts that I referred to when I was working on my specialty, as well as the Wiggs book.
And another lovely person.
Oh, yes. Very lovely person that was gone way too soon and had such knowledge to contribute to the profession. Yeah. So, yeah, I wish I could talk to her as well to do a history episode, but we won't be able to do that, sadly. But I think I will try to interview somebody that knew her even better than I did and try to piece together some more history for her as well. So, when we think about reflecting on Dr. Wiggs being the pioneer of veterinary dentistry and all the contributions that he made to the profession, is there anything that you'd like the listeners to take away from today's episode that would be a homage to his legacy and things that, he would like us to know if he was here today to talk to us?
Yeah, I think even though he had a strong scientific kind of background, he was all about practical results that impacted the patient. He was a very practical person and being able to provide that. Yes, it's fun being able to do really fancy schmancy stuff and research and everything else, but he wanted to make sure that patients were best served.
I think that's the meat and potatoes of veterinary dentistry, is that we have all these patients presenting to us. We will never run out of patients. No. And in order to accomplish dentistry on a daily basis, we can't do anything but practical, real world applications. His contribution, given those winged elevators, has made dentistry so much better. And when we have a patient under anesthesia, being able to efficiently and effectively, without complications, extract a tooth, what a game changer for a lot of people, being able to have the correct instrument to do the job. And an instrument is just a tool, so he had to have techniques to apply to the use of his instrumentation, which I'm sure he impacted thousands and thousands of people over his lifetime, potentially in person as well as just exponentially, given the texts and information that he was able to put out there, and definitely was one of the early pioneers in veterinary dentistry and was able to contribute, given his short lifetime, being able to help us as much as he did. Thank you so much, Heidi, for being able to enlighten us a little bit more about this relationship you had early on with Dr. Wiggs and how you said that really changed your whole trajectory, and how he took you in like a family, and with your daughter and your life and all the things that you had going on helped to facilitate your success and being able to accomplish the status that you reached becoming a veterinary dentist officially, and all of the things that, you helped him with as well. So I'm sure it was a very symbiotic relationship in that way, where you were able to help him accomplish more, being a partner with him in that hospital, and also working with patients and being able to work through the publishing of this textbook. I forget, was he alive when the second edition came out?
No.
He wasn't. Yeah.
He was not.
The year he passed away was,
let's see, 2008, I believe.
Okay. Yeah.
2009.
I
And
remember,
it still took me a while after that to get everything going because there were some legal issues and whatnot, but finally got it done.
Yeah.
And
That's
people were very helpful and
good. Yeah. Because we want that legacy to continue, and being able to do additional editions of the book, because he knows that scientifically things change. And
Right.
I'm sure he would be very proud to have additional editions of the book out there, so that everybody's getting the most up-to-date information that we can offer.
keep his legacy going.
Yes, exactly. And I was at the dental forum when they announced his passing that year, and so I do remember that. I just couldn't remember what year it was. Time's flying by.
I know it was San Antonio because it was a tough year for me. It was tough going to
Antonio.
the meeting.
What a great place for that to be, because it was Texas, his home state. And
True.
yeah, I'm sure all of his friends were there, and everybody was thinking about him at that point in time that knew him well. And again, I wish I would have been able to meet him. But we'll bring him back to life here a little bit with this episode. So I really appreciate this a lot, because I know having to just remember some of these stories and things probably brings you back to a time when this was all happening. As we wrap up this episode, I think it's worth taking a moment to reflect on how far dentistry has come in veterinary medicine, and the tools we use today, the techniques we teach, and the level of care we provide to our patients didn't appear overnight. This is the result of decades of dedication from veterinarians and educators who believe that oral health deserved a greater place in veterinary medicine. And Dr. Robert Bruce Wiggs was one of those individuals. Through his clinical work, his teaching, his contributions to the textbook, Veterinary Dentistry Principles and Practice, he helped build a foundation to continue the support of the profession as we know it today. And Dr. Lobprise reminded us the knowledge we rely on now truly rests on the shoulders of giants. Pioneers like Dr. Wiggs, who helped move veterinary dentistry forward for the benefit of the profession and the patients we care for. And Dr. Wiggs' contribution should never go unremembered. So this episode really is dedicated to all of the things that he did to contribute to the profession and to the lives that he touched through his teachings and his dedication through his lifetime to this profession. So I want to thank you, Dr. Heidi, for being here and for remembering Dr. Wiggs today. Thank you for joining us for this history episode of the Positive Veterinary Dentistry podcast. If you enjoyed this conversation, please share it with your colleagues who are passionate about advancing veterinary dentistry in the profession. Until next time, keep advocating for better dentistry and better patient care for every animal we serve. We'll see you next time on the Positive Veterinary Dentistry podcast.